So good evening. Greetings from Fourrts. We welcome all the participants to this public awareness webinar on prostate cancer. This month, November, is generally called as Movember. It's an annual event involving a growing of mustaches during the month of November to raise awareness of men's health issues such as prostate cancer, testicular cancer, and men's suicide. So this prostate cancer topic becomes the right topic in this November month. We thank Rotary Club of Adyar and Chennai Specialty Clinic for giving us an opportunity to conduct such public awareness webinars for the general public every month. We started this webinar series in the month of September, and we are now successfully, with the support of Chennai Specialty Clinic, running it for the third month today. Fourths is in the pharma industry for the past 43 years, following the motto of innovating for good health. We from Fourths have innovative products in men's health like Milefil, Uphold, Tamfil, and UBQ. At present, we are exporting our products to over 50 countries around the world. We welcome today's speaker once again, Dr. N. Raghavan. He is the senior consultant urological surgeon and uro-oncologist from Apollo Hospitals, Chennai. Dr. N. Raghavan got trained and worked as a consultant urologist and uro-oncologist in United Kingdom. He did his fellowship in Germany. He has 15 plus years of experience in uro-oncology with expertise in open, laparoscopy, and robotic surgeries for patients with prostate, bladder, kidney, penile, and testicular cancer. He was first in South India to perform novel and pioneering works in robotics. Dr. N. Raghavan is a keen academician, researcher, and a teacher. Dr. Raghavan has published 35 papers in international journals. He is a member and faculty in national and international urology and uro-oncology societies. With this short introduction, I hand over the session to Dr. Raghavan for the further proceedings.
Thank you so much, sir. You've been very kind with your words as ever. And our partnership with Fourrts, especially Chairman Veeramani, who has given this opportunity for us to put this across for the interest of the public, has been going on for some time. And I take this opportunity to thank the chairman, as well as an opportunity to thank all the staff in Chennai Specialty Clinic Health Foundation, a non-profit organization which is helping patients who are undergoing complex treatment. We also have to remind the public who are live that Fourrts also runs, along with Rotary Club Adyar, runs a health center in Thoraipakam, looking after people with needs. As you rightly said, this month is a prostate cancer awareness month, and hence taking this opportunity to talk about prostate cancer is the idea. Now, Nagashankar sir, can you allow me to share the screen so that I can share the?
Yes, sir. Yes, sir. Yes, sir. 1 minute. Yes, sir. It is done, sir.
Thank you, sir. Hope all can see the screen now.
You are visible, sir. You can make it bigger. Yeah.
Okay. Right. So
yes, sir.
We are ready to roll. So once again, my most sincere thanks to all the members who were instrumental in arranging this webinar to happen. This is a month of November where there is extra impetus to create awareness on prostate cancer. So the aims of this lecture is to make people understand what is prostate, where is it located, what are its functions, what are the common diseases affecting the prostate, what is prostate cancer, how to diagnose it, and how to treat it. So with this aim, we will start off. So prostate is an organ located in the, it's exclusively men. Women don't have prostate at all. So it is located in a part just below the bladder. It is deep inside the abdomen. It is the last organ in the abdominal cavity, the bottommost of the abdominal cavity. It is located just below the bladder at the point when the urine pipe is coming out of the bladder and coming out of the body itself. The prostate is divided into many zones, an outer zone, an inner zone. Outer zone is called peripheral zone and the inner zone is called central or transition zones. The diseases that affects the prostate includes infection, benign enlargement of the prostate, and cancer of the prostate. Infection of the prostate is prostatitis. It is very common in younger population, especially who do a lot of job which is involving in sitting. So they notice some mild degree of discomfort when passing urine, some pain after ejaculation, and low backache as well. very commonly noticed in IT population, but easily treatable condition. Benign prostatic hypertrophy is benign enlargement of the prostate, which is not cancer. It happens in almost all men at the age of 60 and plus. And therefore, you'll always find that many elderly people, your granddad or your dad is going to pass urine often to the toilet, and they also complains the urine flow is very slow. It's because of the benign enlargement of the prostate. Now, prostate cancer affects less number of individuals compared to benign because, as I said, benign happens in almost every man. But prostate cancer is much less compared to benign enlargement. However, the symptoms of the prostate cancer also are very similar to the benign enlargement. Those patients also complain of poor flow, difficulty in passing urine, sometimes lead in the urine as well. So whenever you find somebody reporting these problems, it is best to go and check it out so that if there are any issues, it can be fixed as well. The cancer as a thing affects the peripheral zone much common versus the benign affects the central zone much common or transition zone much common. This is a picture to say that BPH involves the central part versus this is a picture to say the prostate cancer involves the peripheral part of the prostate. Now, as this talk is on prostate cancer, I'm going to move forward to prostate cancer now. Why is prostate cancer important? This is the most common men cancer in the world. Okay. In India, it is expected to become commonest soon. At this point, it is about second in the rank or fourth in the rank. In some cities, it is fourth, some cities, it is second. The incidence is particularly high in Western world, but India, it is catching up as well. In majority of the patients, we do not know why they develop the cancer, but we believe that environmental factors and hormones have a role to play. It is multifocal in nature. It's not that one bit of the prostate is affected and the other bit can be saved. But as I said, the highest incidence happens in the outer bit, usually men above 60. The good news is that this is a cancer which has good prognosis. Once diagnosed and treat the patient, they do very well. Uh, but even in advanced cancer, those patients can be treated very well and given them a good longevity as well. In early stages, the cancer is located within the prostate, versus as it grows more and more, it starts to spread to the tissue around it, and in advanced stage, it spreads all around the body. Now, how to diagnose prostate cancer? As I said, symptoms. But keep in mind, very early prostate cancer, where the cancer is just starting off, may not have any symptom at all. They just get diagnosed because they went for a mast checkup. In the mast checkup, the doctor examined or did a blood test called PSA and found it cancer from there. That brings to the next point as what is the test that is required. The test that is done is called PSA or a prostate specific antigen. The third thing, once you do a PSA test, if the PSA is elevated above a particular value, or if the doctor examined you and found that the prostate prostate organ is abnormal, then the combination of these two will allow the doctor to do a biopsy of the prostate. The biopsy of the prostate is to confirm that there is a cancer or not. We also do an MRI scan or a bone scan or a PET scan in order to understand whether the cancer is within the prostate or spread to everywhere in the body. Now, I told a lot about PSA test. Now, there are a few things that people have to understand about PSA test. There is a lot of advantages in doing the test, but the disadvantage also remains that sometimes we diagnose very early prostate cancer, which in turn causes more anxiety than the prostate cancer killing the patient. The examination, both with the blood test and the clinical examination, can at times cause false positive results. That's why a doctor's clinical discretion becomes very important. Once found to have elevated PSA, the patients will require further tests in order to confirm or refute the disease. And if we find the cancer, then we have to give some good treatment in order to cure you as well. And during the process of treatment, some patients do get affected as well. Now, the prostate cancer, prostate specific antigen is also related to age as well. Not every age has a strict value. For example, if somebody is 40 and the PSA is more than 1, I'll be concerned. But if somebody is 60, the PSA is only 1, I'm not concerned. So we call it age specific PSA. And there are some complex other things called free to complex ratio as well, which is all done by the doctor in order to discriminate whether there is a truly a cancer or not. PSA can be elevated by other reasons as well. For example, infection, retention, recent sexual intercourse, cycling, prostate biopsy, sometimes examination as well. Now, okay, doctor, who should not have a PSA? Men above 80 years of age, because diagnosing a cancer is unlikely to benefit them in any way. Men less than 40 years of age, because unless they have a symptom, there is no need to do it. Men in whom we do a test without counseling, which is not fair as well. And those patients who are not likely to live for 10 years. For example, he may be a 45-year-old, he has had 3 heart attacks or a stroke, he's wheelchair bound, he's bed bound, he is not going to live long. Now, as I said, once the prostate cancer is diagnosed, there are lots of methods to treat them. Operation, radiation, and hormones, and other newer treatments as well. Now, that is a picture of an operation of the prostate, whereby we can make a cut, remove the prostate, and then stitch everything back together. But in the advent of the 20th century, we have this machine called robotics, which in fact has transformed the way we manage prostate cancer. This machine has transformed the treatment of prostate cancer, that patients nowadays, I do this operation as a daycare. Bring the patient in the morning, the patient goes home in the night and goes to his or his own bed and sleeps in his bed. That is the joy, and that's because of the robotics. Uh, why is robotics better? Because we get almost a 15 times magnification, a 3D vision, it's a double lens laparoscope, and the arm movement is so precise that the operation is very precise as well. Radical prostatectomy is now transformed the way we look after these patients, and patients have benefited so much from this operation. The advantages: minimal complication, blood loss is very limited. I have put 1 to 2 days hospital stay, but nowadays in a fit and well patient, the patient comes in the morning, goes in the night. The recovery of continence is very quick. The recovery of erection is also very quick, and there is an opportunity to give further treatment if there is a need for that treatment. That is the console in which we sit and operate. Now, some patients who don't want operation, or in patients where operation is not the right treatment, we have something called radiation. That we give it from outside. It can be given by an external beam radiation or something called cyber knife radiation. Now, this is the way the cyber knife is delivered. Primarily, what happens is that it is what we call pencil beam therapy. You give precise treatment into the prostate, thereby killing the prostate cells, and can allow the normal prostate to function. The advantage of radiotherapy is that the prostate is still, sorry, there is no cut, no stitch, but the disadvantage is that prostate is still inside. And even more advanced than that is called proton therapy, which is available in Chennai now as well. Brachytherapy is putting some radiation inside the prostate, and it is very useful in patients who have very localized disease and not spread elsewhere. Now, in patients where the cancer is spread outside extensively in the body, we give something called hormone therapy, which in turn controls the cancer and gives a good longevity to the patient. This is a cancer where you don't need to think, oh, I have extensive cancer, I'm going to die tomorrow. Answer is no, you don't need to die tomorrow. We can treat you effectively and give you easily 3 to 5 years of longevity, if not much more than that as well. A common question asked to me is, can we prevent prostate cancer? There are no specific methods to prevent prostate cancer, but being aware will allow early diagnosis and effective treatment. A healthy lifestyle, avoiding fast foods, avoiding char grilled meat, and therefore the char grilled meat has a lot of environmental toxins, which in turn can potentially cause cancer. So therefore, a healthy lifestyle and avoid smoking will definitely reduce the risk of the cancer. Is prostate cancer hereditary? My dad has it. Will I have it? Answer is not necessarily. In one a very specific set of patients where they get diagnosed at the age of 50 or 60 or even less, and two or three members of the household is affected, then they are called what we call familial prostate cancer. They are a very small cohort. There are some genetic factors which can predispose to prostate cancer, like BRCA2 gene, but these are very small proportion of patients. So the take home message which I want to give in the month of November is that prostate cancer is one of the most common men's cancer. A simple blood test will help us to suspect and diagnose the cancer. Early diagnosis allow effective treatment, if not cure. Excellent treatment is available, which allow patients even with advanced cancer to give a longevity. So therefore, I request ladies and gentlemen seeing this program to be aware and to be positive. Thank you so much.
Yes, sir. Thank you so much. So once again, it's actually always, sir used to put things in very, very simple manner so that, so simplicity was very much visible, sir. And cancer means immediately people start worrying, they start
Yes.
worrying. So that, has now gone now, that lot of treatments options are available, even if you are detected with a prostate cancer. And you also told about the advantages of the new treatment which are available currently, which were not there earlier, and even lifestyles to avoid
Correct.
you put, and you have put, in the last few slides, question and answers also you answered, sir. And there are, I think, few questions. So
Sure.
long term BPH, can it lead to prostate cancer?
No, no.
Okay.
Prostate cancer and BPH can coexist, but it is not that BPH will go to prostate cancer. It is not like that. So, but a same patient can have a BPH component and a prostate cancer component. That can happen, but it is not that, oh, I have BPH, I'm worried that I'll become a cancer. No, if a cancer has to develop, it develops independently.
Then how safe is this radiation therapy in prostate cancer, and what are the radiation therapies available?
Radiation therapy is very safe in prostate cancer, very effective as well. So if you think of the radiation as two types, as in radiation from outside and radiation inside is called brachytherapy. That is, you put seeds inside the prostate. Radiation from outside can be delivered with the help of an external beam radiotherapy or a pencil beam cyberknife radiotherapy or a proton therapy. Now, they're all very variants with advantages, disadvantages. The advantage of radiation therapy is that there is no cut, no stitch. But the disadvantage of radiotherapy is that if you given radiotherapy, the prostate is still inside. In some proportion of patients, the cancer will reactivate again. So in patients who have a longevity of 10 years, who is fit and well, uh, generally we prefer to offer operation, and so that even if there is a possibility I need to give radiation in future, I can always come and give. So that possibility to maintain in patients who have a good longevity, we tend to offer surgery first, but radiation is a wonderful treatment as well.
So initially you explained, but still I wanted to ask, which age group is mostly affected with this cancer, sir? Mostly affected with this cancer.
60 plus is supposed to be the ballpark figure. But the problem I have is that off late, we are seeing a lot of patients in the age of 50 to 60, and a small number of every year I see at least one or two patients the age of 40 to 50 as well. So I generally tell people above 40, do a PSA test. If that PSA test is less than 1, at the age of 40, you've done a PSA test. If that PSA test is less than 1, you do that PSA test once in 5 years. If that PSA test is more than 1, A, consult your doctor, and 2, make sure you're doing PSA test every 1 or 2 years. Because the PSA as a test is age specific. For a 40-year-old, a PSA of more than 1 is an important thing. For a 50-year-old, a PSA of 2.5 is important. So it is age specific. You have to be more aware. So if you do a PSA at 40, it is 0.6. You don't need to test it again for 5 years.
So there is another question. Is there any symptoms like pain in genital or anything to detect prostate cancer early?
As I kept on saying, early prostate cancer does not have symptom. I mean, I will take this forum to tell that early cancer has no symptom at all. Let us say early breast cancer. Other than feeling a lump in the breast, you will not feel anything else. Early kidney cancer, an ultrasound will pick it up or a CT will pick it up. Patient will not have any symptom. Early lung cancer, no symptom. A chest X-ray will tell. That is also the reason why master health checkup has become very popular, at least in our country, where at the age of 40 and above, people undergo a full body checkup, looking at least 95% of the problems to be picked up early. So early cancers may not have symptoms. Being aware and testing for it is the only way to pick it up.
There is another question. This is probably not related to prostate cancer. Prostatitis, does it have any link with hernia?
Prostatitis has no link with hernia. No, they are two independent things. And prostatitis also doesn't cause cancer as well, relevant to our topic.
And the next question is, sir, what is the difference between proton therapy and radiation therapy?
Proton therapy. Okay, radiation therapy is that you are giving radiation that will go and hit inside the prostate or any organ for that matter. The radiation is given by something called photons, photons, photons. Now that the radiation or the energy that is generated by photons can be generated by photons or by protons. So proton also generates energy that will give the radiation. So the proton energy is extremely specific. Let us say I tell the proton ray to go and hit it at 1.3 centimeters. It will go hit it at 1.3 and stop there. It doesn't go to 1.4 and 1.5. So the proton therapy is a much more precise therapy, and the amount of radiation scatter that happens is very small compared to the photon, which is the traditional therapy. So that's why protons has a slightly bit advantage. In India, we have a proton center in Chennai. The only thing with the proton therapy at this point of time is the cost. It's a hugely costly therapy, but it is very precise.
There is another question. Sir, is chronic back pain a symptom of advanced prostate cancer?
Chronic backache in India most commonly is related to vitamin D deficiency, posture, especially in IT professionals, or sometimes other issues like disc prolapse or other things and other things. Not in some patients with advanced prostate cancer may present with chronic backache, but that is like a super tiny proportion. It is not like every patient will have it. No.
Sir, there is one more question. I think this is a personal question of a person. So, sir, one of my friend is having right side testis and left side testis. There is a difference. One is big, one is small. Is there any problem or is it cancer?
I cannot tell the answer on a webinar because I do not know. All I would say
Physically,
is
yeah,
get it examined by a medical professional,
yeah,
and if necessary, do an ultrasound scan. These two things will put your mind at rest. That's all I will say.
true, sir, true. Okay, sir, I think that's all is the question. Yeah, I think we have answered most of the questions.
Thank you, sir. Thank
So
you
thank
so
you
much,
so much, sir.
and really
Once again,
appreciate that.
your simplicity is very good, sir. Actually,
Thank you.
so fear of many must have gone today. So thanks for giving us this opportunity. We thank once again Chennai Specialty Clinic and Rotary Club of Adayar for continuing this session. So we'll continue this for long, sir. Thank
Thank
you
you
so
so
much, sir.
much. And yeah, okay. I just check the chat box and all is well.
Yeah.
Okay. Thank you so much, sir. It's a pleasure. I think you have answered all the
Yes, sir. Yes, sir.
questions.
You can
The
also just go
Q&A
through.
has
Yeah.
been done.
Yes.
Uh,
Yes.
okay. Thank you so much, sir. Thank you so much, sir.
Thank you, sir.
Nagashankar, sir, thank you so much.
Yes, sir.
And
Thank
my
you.
special thanks to Rotary Club Adayar, Fourrts, and Chennai Specialty Clinic Health Foundation for making this happen, especially to you who have been pioneering and instrumental